Good evening. How are you? Good to hear. It's nice to see you again. I see that you're here for another cranial nerve examination. Oh, good. Yeah, I'm glad to have you. So, why don't we go ahead and go through our regular questions, see if there's any updates, okay? And then we'll get started with the examination. Okay? So, it looks like you were here last year. Okay, good. Okay, so that's good to hear. Has there been any new events that have occurred that I should know about? No, okay, perfect. Don't want anything bad happening to you. Okay. And do you have any new allergies or medications that you're on? Okay, and how long have you been taking that? Okay. And how does it make you feel? Are there any side effects? Okay. Good to know. They do sometimes cause headaches. Are you drinking enough water? Okay. Okay. Now I'm just going to want to take a couple vitals before we begin too, since it has been a year, okay? And I don't see them from any other doctors, so I'd like to go ahead and get just so we can have that taken down. But we're also going to do some measurements as well, just to see if there are any changes. Okay, so I'm going to do your vitals first. Alright, just take some deep breaths for me. Good, thank you. Perfect. Okay. Good. Has your diet and exercise changed? Alcohol consumption? Okay. Good. Perfect. Just here right on top of your chest. Thank you. Good. Alright, thank you so much. Alright. Okay, you can just open wide, please. Thank you. Good. It'll just be a couple more moments. Wonderful. Okay, you're all good to go. Perfect. Alright, so we got that in there. Good, okay. So just gonna mainly measure your face, okay? Because since we are focusing on the cranial nerves, that's where I mainly want to focus your measurements, alright? So first I'm going to get to just good, okay. Perfect. I'll do around your neck here. Okay. And the side of your face. Good. just a few different points that are different from one another. Let's see. Good. Perfect. Good. Each eye. Good. Okay. To your ears, just. Okay. That one looks really good. Okay, perfect. That's great. Alright, let me take those measurements real quick for you. We haven't been as busy as we usually have. I think just with everything going on. A lot of people trying to stay home, which is good. Good. Okay. So we're going to go ahead and start with your eyes. All right. And I'm first going to do a light reaction test, okay? And just kind of examine them. If you could just cover one of your eyes. Thank you. I'm going to get really close here so I can kind of look a lot more in depth. Okay. Good. Okay. If you could switch. Thank you. Really, really close. It might be a little difficult to see afterwards. It should recover quickly. Good. This lets me see behind the front of your eye and more to the back. So I can see if there's any cataracts forming or glaucoma. Okay. Sometimes we can see that also with like a heart attack or a stroke. So we just gotta make sure that everything is clear and everything would look good. So let's Alright, next I just want to feel around in your eyes, okay? Just to see if there's any pains, okay? If you could close both of your eyes. Thank you. Good. Perfect. Okay. I'm going to try to test your peripherals. I want you to do single eyes this time instead of both at the same time. So go ahead and just cover whichever one. Okay? Good. Okay. Just be using one hand this time. Just be flashing a few numbers. Okay? was that peripheral? Just let me know. Perfect. Good. Okay, we're good. Good. Sometimes what happens is if we use both eyes, then they can sometimes rely on each other, so we need to use them individually at times. Good. Good. Okay, and you can switch. Thank you. Good. 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 Okay. And now we'll just hold up some fingers. Good. Good. 2. Good. 3. 4. Good. 4. 2. Very good. Okay. Take these off for now. Alright, so let's go ahead. Eyes look fantastic. Perfect. Alright, okay, perfect. So we're going to move on to just your face right now, just to see how reactive it is, okay? I first have a cooled jade roller, okay, just to see how your skin reacts to temperature change, okay? This one is pure rose quartz, and I just had it left in the fridge. Alright, so we'll roll this on your cheeks and your forehead, alright, just to see if you can feel a dramatic change or not, okay? Alright, great. Okay, so here it is. Nothing too scary. It's totally normal. It's very, very gentle to the touch. Very nice on the skin. Okay. Alright. So we're just going to gently roll this on your cheeks. Like I said, it's cooled. Okay. How does that feel so far? It is really chilly. Okay, good. People use this usually like to boost collagen in their cheeks and to help blood circulate. It's supposed to help with like wrinkles and stuff. I just like to use it because it is gentle and it's a very nice little tool that kind of helps people relax at the same time. So you can feel this side as well. Okay, good. Good. Alright, and then we're going to move to your forehead. Good. You can feel all that, even on the temples here. Okay, but on this side. Oops. On this side as well. Okay, good. Perfect. Alright, great. So now I'm going to want to test your facial expressions, okay? So first I want you to raise your eyebrows, okay? And then Do you feel all this? While I do that. Yes? Okay, so lower your eyebrows. Good. Perfect. Okay. And if you could just smile, just a nice gentle smile. Let me know if you could not feel this on any part of your face. Okay, good. There's definitely still have sensation there. Okay, and then now frown, a nice gentle frown. Good. Perfect. Good, and now if you could puff your cheeks out. Thank you. I'm just going to gently poke each one. You feel that? Okay. Good. Okay, and now I want you to tightly close your eyes, and I'm just going to feel right at the creases. Okay, I won't touch your actual eyes, okay? You can feel that? Okay, good. Good. And now widen your eyes. Okay. Good. Alright, you can relax now. Thank you. Perfect. So now I want to try just poking different tools. Okay, this one's pretty good because it has a fairly sharp pointy end and a pretty nice dull on this other end. So I'm going to just switch back and forth while your eyes are closed, and you just tell me if one is dull or sharp. Okay. Alright, so go ahead. Okay, good. Good. Sharp. Good. Dull. Okay. Dull. Alright. Sharp. Good. Sharp. Fantastic. Okay. Your facial nerves are perfection. It's really good because a lot of clients that I have come in, usually they will have one very small area that is slightly numb. So it's really good to see that all of yours are in order. That's great. Okay, I think we're gonna move on right after this. Perfect. Okay, so I will need to put my gloves on for this next one. We're gonna be looking in your ears and doing a little bit of hearing. Okay. Alright, I do need one more thing. Okay, just need this little earpiece. Alright, let's actually start on this one because I always start on that one. Okay, so before I begin, I just have this little light here. I'm just gonna kind of peep around just to see what's going on in there before we start. Okay, just gonna feel around a little bit. Okay. Oh, these look really nice. You ever had ear infections before as a child or just recently? Okay, good. That's really good. Because a lot of children these days, it seems like they're getting more and more ear infections. So that's really good. Okay. Check. Perfect. This one looks really good too. Okay. So for this hearing test, I'm going to stand actually a little bit farther away for a couple of words. One in one corner and then another. Okay. And then of course I will get a lot closer to you. Okay. So go ahead and close your eyes. Alright. And we're just going to whisper a word. And you just repeat it back to me, okay? Okay, thank you. Scattered. Scattered. Good. Capricious. Capricious. Perfect. Okay, great. Okay. Just keep your eyes closed. Peace. Peace. Good. Act. 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 Good. Perfect. Market. Market. Good. Righteous. Righteous. Good. Spark. 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 Good. Ocean. 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 Good. All right. Unwritten. 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 Very good. Okay, you can open your eyes now. Thank you. That was really great. Did any of the words or certain letters sound more crisp or dull to you? They all sound pretty even? Okay. Good. Alright, next we're just going to be looking in your mouth and then doing some taste testing, okay? Alright, great. So if you could open your mouth for me, please. Thank you. Just gonna move your cheeks over just a little. Good. Good. Hard palate, soft palate. Look. Like the correct color. Teeth look pretty good. Do you have any sensitive teeth? Okay. Alright. Tongue. Could you put your tongue to the top of your mouth, please? Is there any pain if I do this? No. Okay. Alright. So, open your mouth. I'm just going to test. Yeah, gag reflex. You don't have one? Okay. So then, I'm just going to push right here. I just want you to say caw. Caw. Okay. Good. Caw. Good. Okay, and now just say go without, just try to keep your mouth open as much as you can. Go. Good. Okay. Yeah, I'm just testing to see if there's any unevenness with your mouth, if there's like a tumor or anything like that. We just want to make sure it's all even and round, okay? Okay, perfect. Okay. Next, I have some tastes for you, okay? They each have their own little syringe, okay? So I'm just gonna pop these right there into your tongue. Toffee. Okay, perfect. That's great. Snickers, Okay. Butter, yeah. Okay. Very good, yes, mango, Okay. Rose. Good job. Oh, you don't like that flavor? I know, a lot of people, it's really 50-50. Mint, yes. Okay. Orange, Okay, last one I got for you here. Matcha, for like a green tea kind of flavor. Good job. Oh my gosh, good job. Okay, perfect. Okay, so the next one, I'm going to be checking your nose and for scents. Okay, so I want to just go ahead and look in your nose real quick. Okay, before I begin. Just a quick, I don't need to do anything in depth that much. Unless you've had like some pain or swelling. Okay, that looks totally fine. Just feel. Feels totally fine. Good. Okay, so you don't need to close your eyes for this or anything like that. Just need you to take a whiff of this right here. Lavender. Okay. Like a fresh laundry. Good. Okay, perfect. Kind of like. Okay. Yeah, no, that's definitely it. Yeah, kind of like a garlicky, just very savory kind of smell. Very good. Alright. Take a nice deep breath. Jasmine. Okay. And this one. Sandalwood. Very good. Okay. Good. Bergamot. Yeah. Kind of a little bit of an earthy-ish smell. Yeah. Yeah, a little bit. Kind of a fresh lemony kind of smell. Perfect. Let's go ahead and get those last notes in here, and then I want to move on to your accessory nerves, okay? Say that that's on a 4-point scale right there. Okay, good. Okay, perfect. Okay, so we're going to move on to accessory nerves, like I just said. And these are just going to be different nerves that are more on your torso and your neck, just a little bit. Okay, I like to do these and add these at the end because we are all connected and you never know, there might be something awry that could be causing pain other places. Okay, so what I first want you to do is to shrug your shoulders just up for me. Okay, yep, just up like that. And if I put pressure, if you try to resist, is there any pain with that? Just a little sore? Okay, alright. Okay. Next thing I want to do, since you have a short sleeve on, I'm just going to draw my finger inside of where your bicep is, okay, to see if you can, if there's any feeling right there, or if it's sensitive or dull or anything like that, okay? Right, so this is going to be right here. You feel that? Okay, try one more time. Okay, and one more. Good, okay, move on to this side. Good, okay, once more, slightly lower. Good. Okay, good. Perfect. Next, I want you to hold. We'll just do the tip of this, okay? I want you to hold this in your hand. Gently hold your hand. I want to see if you can feel it in your hand, okay? So we're going to do each one. So hold on that one. And just close your hand. You can kind of move around a little bit. Can you feel it? Okay, good. Right. Over to the other side. You don't feel like you have to strain your hand too much? Perfect. Okay, so take that one. That's really good. Okay, and now if you could just gently move your head to each side, please. Good. It doesn't seem to be too much tension. You might need to, especially for headaches, depending, but there could be maybe something with your spine. You might need a chiropractor or something like that, because they can usually fix everything, because if one thing's out of line, it just messes everything up. So, otherwise, on your face and neck look pretty good. What I want to do is just to feel each. And you could feel all of those. Great. Okay. And the very last thing, if you could just put your hands on mine. Great. And just let them rest there. Mm-hmm. They look pretty steady. Great. Okay. You can have them back. Thank you so much. Okay, great. Perfect. Alright, so your cranial nerves look fantastic. So great job keeping yourself nice and healthy. Yeah, great job. And do you have any questions for me at the moment? No. Okay, well that's great. Well anyways, you are all good to go. Thank you for being such an amazing patient. Yes, of course. And hopefully we'll see you again soon. Yeah. Okay, great. Well, you have a beautiful day. We'll see you next time. Thank you. Bye-bye.